The Yoon administration and the medical community are locked in a standoff that is escalating quickly. More than 9,000 trainee doctors have handed in their resignations in protest of the government's plan to increase the medical school admissions quota by over 60%. But Seoul has shown no signs of backing down, issuing return-to-work orders and promising to take legal action for those who do not comply. To discuss the government's controversial plan and the medical community's controversial response for this week's Weekly Take, we have joining us via video call today two guests. First, we have affiliate Professor Kim Byung-ju from the Hankuk University of Foreign Studies. Professor Kim, hello.
Hello.
And this week, to give us a doctor's perspective on the issue as well, we have joining us via video call Dr. Alice Tan, an internist at Ms. Medi Women's Hospital here in Seoul. Dr. Tan, hello, and thank you for your time today as well.
Thank you for inviting me.
So the government announced earlier this month that it would raise the quota of medical school admissions from 3,058 by an additional 2,000 by 2025. It would be a 65% increase and the first increase in 19 years. The administration has argued that the nation needs more doctors due to the fast aging population, as well as to address the disparity in the availability of medical services in rural areas. The government has pointed out that the number of practicing physicians in the country compared to the population is far below other OECD countries. So, Professor Kim, let me start with you. What's your take on the government's plan?
I think the plan is something that this Korean society needs absolutely, and it's a necessary step. And the fact that we have not seen so far for 19 years, as you mentioned, the increase of medical students and supply of doctors itself is a big problem. And this is overall, of course, more than anything, it's a question of medical services availability to the people. We need more doctors everywhere in all different specialties and different regional, different places around the country. There's no question about that. But even more important than that, the way I see it in the long run, going over and beyond the medical issues, the social structure and national human relations, human resources policy, and so on, when we see how do we put this? The top students graduating from high school, all of them, almost all of them go to try to apply for medical school and end up going to medical school. And after the top students go to the medical school, the rest of them actually looking for different specialties of scientists, technicians, technologists, different kind of vocations. It's a serious, problem in terms of distribution of human resources for the country. So there is a great distortion, market distortion. When we say the supply has not changed over the last 19 years, that's a malfunction of the market system, and overall, we have seen a very serious problem with this, and then it's resulting in the deterioration and compromise of medical service provision, but not only that, but also income distribution and all that kind of stuff. So this is not just a medical issue. This is an issue about how country manages its human resources and actually build for its future. When the best and the brightest go into just the medical service, what happens to country's science, technology, management, policymaking? This is much more complicated and much more challenging issue than what we seem to see in just in the facade of the question of provision, supply, and demand of doctors for the patients.
Dr. Tan, let me turn to you. What do you make of the government's plan to increase the med school admissions quota?
Well, I'm glad that the government is paying attention to healthcare policy reform. I think it is long overdue. However, I disagree with some points that Professor Kim has made, and I disagree with some points of the policy in general. In regards to the increase in the medical school admission quota specifically, we should note that this is only one part of a four package policy, reform policy that was released by the government earlier this month. My issue is with the timing, with the magnitude, and the order of some of these changes. In other words, you pointed out this is a 65% increase in the admission class for medical school students. In other words, 50 more students per medical school throughout the country if we just average it out. Uh, this is a huge increase in terms of one class. How many years can this go on sustainable? And then what when we have, too many doctors? Our population in South Korea is shrinking. There is no doubt about that. We are having fewer than 150,000 births per year. Some professors, especially at Seoul National University, Oh Jung-tae, I think, 교수님, he specializes in studying populations, and he predicts, I think in the next 50 years or perhaps 100 years, the population of Korea may shrink to one half of what it is currently. So my question is, if the population is shrinking, and for 19 years, the medical community has worked very hard to provide excellent quality medical care at a very affordable price. Yes, we have a problem now with accessibility in the rural regions. Why do we have to make such a dramatic change at this point? And why, of all the different parts of the packages, why increasing the quota as the first major step? There were so many other parts of the quota of the policy, the other packages that I thought, looked very reasonable. But for some reason, the government decided to go with the most controversial and the most contentious part of the policy first. And so I disagree. I think it's, in terms of magnitude, it's too much. The timing is too soon. I agree that there is a problem in terms of the medical health force in the rural areas, and the distribution in terms of doctors not going into primary care and essential medical fields. But I don't think this is the answer. We have a problem, but this is not the answer.
May I respond?
Of course, Professor Kim.
Yeah, Dr. Tan said the magnitude is a problem. Well, magnitude is a problem because for the last at least 19 years, I heard different numbers before in terms of substantial increase, but basically the supply has been limited for the last 19 years. In order to fix it, we need large number in terms of rectification of the current situation. So, I'm not saying we have to stick with this specific number here, but we need large change, no question about that. And why all of a sudden all these things, Dr. Tan asked? Well, just let's look at the numbers. In terms of services, right? Service availability in different corners around the country, Dr. Tan agreed, everybody agrees, we need more doctors in different corners around the country. There's no question about it. What about the income of the doctors? They're talking about $200,000 per year income, 200,000, 300,000 per dollars per year income for these doctors as average. And that is, we are being told by OECD that this income is much higher than 100,000 compared to 100,000 OECD average. Korean doctors are making 200,000, 300,000. What does this mean? There's absolute dysfunction of the market, demand and supply here. And doctors have been creating what economists have been calling the rents. Rents have been created when supply demand is not working. And so doctors have cut off the supply of their doctors, and then they were making lots more money than what's justified for. And as a country as a whole, we have to change, we have to repair, and we have to rectify this problem quickly. And the deterioration of the services quality in the future, of course, we have to be mindful of such possibility. and we have to constantly think about it. But the thing is, we have this very serious problem in front of us right at this point. Shortage of the doctors, and doctors making outrageous amount of income compared to other countries, which indicates major malfunction of the system. So we have to fix that problem while being mindful of such future challenges in the future. And let's talk about the deterioration of medical services. I don't know of any country saying, well, our country's doctors are stupid, dumb, and less educated than they should be, and therefore we are suffering from medical service quality problems. Never heard that before. When you have more doctors, your people suffer because of a bad quality of medical service. I don't know of such cases. So theoretically, it's a problem we should be
Right.
mindful of, and I support the idea of being mindful of it. But
Right.
I'm not really sure whether that problem is real.
Dr. Tan, let me give you a chance to. Dr. Tan, let me give you a chance to respond before we move on.
Maybe you need a doctor for your throat. And in Seoul, it's very easy to go and find an ENT doctor or a dermatologist or specialist. I think the problem is we need a demographic map of the entire country, in which we have the population mapped out, the male-female distribution, the distribution of women of childbearing age, distribution of all the ages. That we need this map now. We need, on top of that, we need physician density in all of the regions of the country. We need to know where the healthcare resources are located currently, what the transportation infrastructure is, and the telemedicine infrastructure is in all of these different regions. We need this map for what the situation is currently, and then a predictive map in terms of what will happen over the next 10 years, over the next 20 years. There are certain regions where the physician density is problematic, but there are other regions where we could say that it's adequate, more than adequate. And so it is a distributive problem, not an absolute problem. And then in terms of physician pay, this is I think, a valid point. I think society needs to come together and ask, is it right to be paying more to get your hair cut than to be seeing a doctor? Because, when you go in to see a doctor for say a repeat visit, the cost in South Korea is maybe out-of-pocket cost is 15,000 won, which is
about
not
12 US dollars.
15,000 Korean won, which is right, about 12 US dollars, which is much less than the price that I would pay to get my hair cut. So I do find the argument that doctors' pay is too high a little bit distorted, especially since we need to put into consideration when you're paying to see a physician, you're not just paying the physician, you're paying the hospital fees, the administrative fees, the nursing fees. All of these fees are included. And so, we need to consider. In my career as a doctor here in Korea, I've had patients come from all over the world, and I've also traveled to different countries to see their healthcare systems up close. I've gone into hospitals and done tours. So I know what hospitals look like when they are underfunded and when the doctor quality is poor. And I know that the doctor quality is poor because patients come to me, they've come to Korean hospitals from these other countries to get medical care because they were not well served in those other countries. So I would like to see that Korea remains in that position where we are in a position to help other countries with their medical care instead of going down in physician quality.
Right.
So the 2,000, I think it really is an outrageous number to say that we need to increase by 2,000 all of a sudden.
We do have to move. We do have to move on to other topics as well. But I do feel we have raised a lot of points, so perhaps we can give each other one more chance to respond. Dr. Kim, I feel you would wanted to say something.
Yeah, Dr. Tan, your points are very important. The thing is, to further clarify that point, we have to separate two related but separate issues here. Korea has succeeded dramatically in terms of managing its national healthcare system over the past several decades. Korea has set an example for the world, and we've been extremely successful in managing the medical care system here. And I have many medical doctor friends here, and they're unhappy with it because they want to get paid even more. All right. The thing is, Korean patients, Korean people have been happy and quite satisfied with well-managed national healthcare system. That's one issue here. And the other issue is doctors' pay in comparison with other vocations, national income distribution, human resource supply question, where we see a real problem here. And I'm saying we got to fix this problem. If we don't fix this problem, we are going to actually ruin this success. If we cannot control doctors' pay and cut off all the extra supply of doctors, we will eventually ruin national healthcare system here. So all the more, there's a reason, that we have to work on doctor supply system in order to maintain the continuing success of national healthcare system. Otherwise, we are going to see problems we've seen in countries like United States, like skyrocketing medical cost. If we don't do anything about this doctor income going twice, 3 times higher than currently the average of OECD, and everybody, all young people, everybody wanting to become doctors, that's going to continue to greatly distort overall national development of science, technology, academia, everything in the education system.
Dr. Tan?
I think we're in this position right now with the doctors on strike precisely because we've had many well-meaning policymakers, experts in sociology and political science and healthcare policy in the discussion, but perhaps we need to include more physicians in the discussion. And I think it's time to go back to the drawing board because when you have an entire, generation of young doctors who are unhappy with what is going on, I think this should send you a signal in terms of, they don't feel that their voice has been included. So what I would like to see is sort of going back to the drawing board. We have the government proposal. There was a town hall meeting before the announcement of this policy. But we need to go back to the drawing board. And yes, there are multiple stakeholders whose voices are very important. They all need to be taken into consideration. But when it comes to health care, taking care of the health of individual patients and the health of the nation, it's really the doctor who knows best. And we need to get many different doctors' voices, their inputs. And really, it's the doctors who are going to be providing the care. So you can try to force policies down the throats of doctors, but unless the doctors agree, it's not going to happen.
Right.
And the doctors
right.
know that's what's best for the patients.
Let us move on to another side of this controversy, which is the medical community's response to this issue at the moment. As we mentioned, over 9,000 trainee doctors have handed in their resignations, and the standoff, it seems to be going nowhere at the moment. There has been criticism from some quarters that the doctors are perhaps taking the most extreme option at the moment. Dr. Tan, what do you make of such criticism?
I find it very unfortunate that we're in this situation. Doctors don't want to go on strike. We want to be taking care of our patients. The needs of our patients have always come first, and they will always come first. But when we feel that there are policies that put the healthcare of our nation at risk, that are not acceptable, and our voice isn't heard in a discussion setting, I think that's when they feel that they need to take action. It is not just doctors in training, it's medical school students who are concerned about their future. They're talking right now about not coming to school, basically. And then what will happen? Instead of having 2,000 more medical school students added to the incoming class, there could be zero medical school students because they may all go down a year if they don't have enough medical school days of education. And so, this is a very unfortunate situation, but I do feel that it can be solved through dialogue and negotiation. And so we have, one proposal, the government's proposal in place. I think doctors also need to sort of consolidate what it is that we want, what we think is good for our country. We do recognize that there are problems. We recognize that we need to expand rural healthcare, or at least provide for healthcare in rural regions where there are medically underserved populations. But I think in terms of coming to a solution, it needs to be much more inclusive and taking into account more physician voices. And of course, within the physician community, we have doctors who are at university hospitals, we have doctors in community practice, private practice. And so we need representation of all doctor communities.
Professor Kim, what do you make of the current standoff with the government, between the government and the medical community?
I think Dr. Tan,
Professor Kim, I think we've lost you. Professor Kim, we lost you there for a second. Can we try starting that question again? Yes. So what do you make of the current standoff between the government and the medical community?
Yeah, I think Dr. Tan used the expression that I really like in responding to this question. That is, young doctors unhappy and young doctors concerned. Okay, young doctors unhappy about what? About change. They're unhappy about this coming change. What does that mean? They're happy with the existing system. They're more than happy with the fact that they can make $200,000 per year, 300,000 per year, which is 2-3 times higher than OECD average. And actually, in Korea, income distribution, if you make $100,000 per year, that's way above 10% of income bracket. And if you make 200,000, 300,000, you're just totally top income maker. And that's why everybody wants to go there. And young doctors are really happy with this system where they're enjoying extreme amount of rent seeking here. And why rent seeking? Because the supply was cut off when the demand was rising. And this is a total malfunction of the entire system. And if they're concerned about this change, they're concerned about this correction. And they have to be concerned about it because this whole system has not been working at all. We got to fix it. And we have to act really quickly because this is a serious problem. So their unhappiness, their concern just reflects the nature of the problem. The medical doctors have been enjoying unreasonable amount of rent seeking in the malfunctioning system, and we have to fix it.
Dr. Kim, we are out of time, so we are going to have to leave it there. But we appreciate both your very considered thoughts on this topic today. We've been speaking to Professor Kim Byung-ju from the Hanguk University of Foreign Studies and Dr. Alice Tan from Ms. Medi Women's Hospital. Thank you once again for your time today.
Thank you very much.